Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We've now administered more than 106,000 doses of vaccine in our province. More than 16,200 Albertans have now been fully immunized with 2 doses. Over the last 24 hours, we have identified 355 new cases of COVID-19 and completed about 7,300 tests. Our positivity rate currently stands at about 4.9%. Looking to schools, there are currently active alerts or outbreaks in 298 schools, or about 12% of the schools in the province. These schools have a combined total of 701 cases. Currently, in-school transmission has been detected in 66 schools, and of these, only 51 have seen only one new case occur as a result. Encouragingly, the average daily number of new cases in the school-aged population continues to fall week over week. Looking at last week, on average, 71 new cases were identified each day among school-aged Albertans. This is down from the 131 daily cases that we saw on average the week before school started in person. So far, returning to school in person has not caused increased spread in this age group. And as I said, in fact, cases continue to fall. We also continued to see hospitalizations decline over the weekend. Currently, there are 556 people in hospital, including 102 admitted to the ICU. The steady decline we're seeing is encouraging and a testament to the ongoing hard work of so many. Sadly, I must announce that 10 new deaths were reported to Alberta Health in the last 24 hours. My sympathies go out to all who have lost loved ones recently, whether to COVID-19 or any other cause. While our cases and hospitalizations are trending down, we still have work to do. We have reached a place where we should be able to further ease measures on February 8th, but we have seen cases fall and rise before. We all must remain vigilant and be extra careful to help keep schools, continuing care facilities, and all other settings safe, and to keep our hospitalizations trending downwards. We all must keep doing our part to protect ourselves, our loved ones, and our community at large. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through our first caller, please?
Thank you. Yes, the first caller is James Keller, Globe and Mail. Please go ahead.
Hi, Dr. Hinshaw. Can you tell us a bit about, or first of all, just an update on what the current numbers are for the variants? And is there any more information about that case that had no links to travel? Are we any closer to finding out where that came from?
So as of today, there are 51 total cases of the variant, both the variant first identified in the UK and the variant first identified in South Africa. And we will be posting numbers twice a week, so new numbers will be updated on the website tomorrow. We have continued the investigation in the case that I've spoken about before that had no connection to travel. At this point, we still have not identified a source. But at this point, we also have not seen any further spread outside of that household.
Operator, could you put through the next caller, please?
Thank you. Audrey Neveu, Radio Canada.
Hi, Dr. Hinshaw. I want to know, we are seeing less cases every day, but also less tests than about a month or two ago. The positivity rate seems to be falling down, but it's always hovering around 5%. So I want to know, why are the number of tests lower, and should we keep that in mind when we look at the positivity rate?
The reason for the declining number of tests, we have been looking at our data and talking to our frontline teams and colleagues to understand what trends we're seeing, and I think there are a couple of different factors. One of them could be that as we have less people who are symptomatic, we have seen For example, a dramatic decline in all kinds of respiratory viruses, not just influenza, seasonal influenza, but many other kinds of respiratory viruses that normally circulate at this time of year. We've seen a dramatic drop, so it could be that there are fewer people who are symptomatic and therefore fewer going for testing. It also could be that there are some people who maybe are just staying at home and even if they are feeling a bit ill, they don't want to go out and get a test. We are encouraging anyone, if they do feel ill, if they are a close contact, if they are part of an outbreak, to go for testing, as that is the most helpful way for us to track the overall trends. However, independent of the testing behaviors that people go or don't go, the positivity rate is independent in some ways. So that is the proportion of people who go for testing that come back positive. And so whether we have, again, as we had today, under 10,000 or over 10,000 tests, that positivity rate is a reflection of how much disease is circulating within that group that's getting tested. So it is encouraging that it has been declining, although, as you say, over the last week or so, we've seen it plateau a bit. We hope to see it continue to go down. And the last thing that I would say is that, of course, as we're looking at these numbers, the hospitalization numbers are independent of people who may choose or not choose to go for testing, because the hospitalization numbers reflect those who have COVID-19 and need care because of that infection. And so we are seeing those numbers over the province slowly go down. In some zones, interestingly, we are seeing a slight increase in hospitalization numbers, even as case numbers go down. And so, again, it's really important that we're watching that metric as well, because that is independent of whether or not people may choose to get a test if they have mild illness. And it does tell us that overall across the province, our trends continue to go down in those who need acute care.
Operator, could you put through the next question, please?
Jesse Weisner, Global TV.
Hi, Dr. Hinshaw. Thanks for taking my question. Wondering, are there any new variant cases not linked to travel? And also, that's a jump of 14 cases since Friday. So what's your level of concern over that? And previously, the province cited confidentiality in not releasing any location details of the new variant cases. So what more details can the province release, such as which zones the variants are in? Other provinces like BC and Ontario at this point have identified and released this information.
We are looking at being able to, on our website, have that information reported by zone. As I mentioned last week, we are still aggregating our variant cases manually, so we don't have an automatic data flow at this point in time. And so to make sure that we sort out, for example, where someone lives versus where perhaps they were tested, versus if they need hospital care where they're admitted. And some of those things we are able to do very quickly with our regular COVID-19 data flow because it is all automated. And for the variant cases, we're doing a lot of that by hand. So we're looking at being able to provide that zone level data ideally by next week. With respect to the travel-related versus non-travel related, we are investigating at this point in time 2 other households that, in addition to the one that I've spoken about before, that have a total of 3 cases, so 1 household with 2, 1 household with 1 case at this point that are confirmed to have the variant. We just received that information earlier today, and so we are doing an investigation at this point in time. We don't know a travel history, and with this new confirmed case result of these 3, we will be doing further investigations to determine any sources or linkages.
Operator, could you put through the next question, please?
David Staples, Edmonton Journal.
Hi, Dr. Hinshaw. Thanks for taking my call. Through the lockdown, our eldest people, seniors, have been suffering a lot of isolation, not being able to see people. I'm wondering, as in the next little while, as they get vaccinated, and we hear 16,000 people now have 2 vaccinations, what's going to be the prognosis for them in terms of being able to return to being able to visit normally with family members? And can you address both people inside long-term care institutions and then just people living in the general community? When will they be able to freely see people in their own family as if they were like normal?
First of all, I want to say I know that older Albertans, and particularly those who live in facilities like long-term care or supportive living facilities, have been carrying a very heavy burden throughout this pandemic. For those who've been involved in outbreaks, obviously there's been a high degree of severe outcomes, including death. And for those who haven't, there's been a heavy burden of the challenges that come with restricting visitors. So I know that one of the things that we all want to be able to do is to support the overall health of those individuals. We did loosen our visitor restrictions last summer, but of course with the increasing numbers in December had to tighten some of those up again. It's encouraging that we have vaccines now for those long-term care and designated supportive living residents. As has been pointed out, though, we still have work to do in other seniors' facilities as well as those who live in their own homes. And even once we're able to vaccinate all of those individuals, there's still work to do to vaccinate those who would want to come and visit them. And at this point in time, while we know that the Moderna and Pfizer trials did include participants up to their 80s and 90s, they did not include in those trials participants who live in these kinds of congregate settings, and we don't yet know the effectiveness of those two vaccines on people being able to still get the virus and not have symptoms. The effectiveness that was measured in the trials was how well it protected against symptomatic infection. And so unfortunately, I don't have a specific time frame right now because we do need to wait until we have more information about how well the vaccine protects against asymptomatic spread and asymptomatic infection. But of course, all of our hope is that once we get to a point where we are able to offer the vaccine to a large proportion of our population and have that herd immunity reached, that we will all be able to go back to having more activities, including those visits with the family and friends that we've missed over the past many months.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Has the provincial lab reached the ability to test 300 samples a day for the specific mutations in the variants? Also, what is the maximum capacity of the lab to test for the new variant and the potential for other variants that could arise? And since we're seeing lower case numbers in the province than we did a few months ago, does that mean will all positive samples a day undergo the specific testing?
Right now, the lab has reached their goal of being able to test 300 samples per day in the screening test for the variants of concern, the one that was originally identified in the UK and the other originally identified in South Africa. And so again, that screening test looks very specifically for a couple of mutations that are found in those variants of concern. And again, they are able to do that faster test on 300 samples a day. So as we see our case counts dropping, of course, that's a greater proportion of our tests that we will be able to run through that screening process for the variants of concern. In addition, they have also reached their target by this past week of being able to screen or do full genome testing on 400 samples per week. And so, again, as a reminder, that full genome sequencing is something that we can do to be able to see the entire genome of SARS-CoV-2 virus, which is what causes COVID. And that will help us detect if there's any kinds of variants or any kinds of mutations, not just focused on those variants of concern. They are, in addition to that, working to see if they can further expand their capacity. Of course, there are equipment and supply needs for that, which, as you can imagine, are in high demand globally. But it's good news that the lab has achieved their targets and are working to further expand as they're able to get the equipment and supplies in that they need.
Operator, could you put through the next caller, please?
Rafi Bouchikanian, CBC.
Hi, Dr. Hinshaw. I understand the AHS is looking at legal action against the church in Parkland County that's remaining open despite closure orders. Can we know what that action might consist of? And also, why not also send a stronger message by issuing fines or a penalty, at least, to the 300 people who showed up at this church yesterday? Thank you.
Alberta Health Services and the executive officers who work at AHS, just like law enforcement officials who work for different policing agencies, are independent officers who enforce the law and the orders underneath that legal authority. So I don't have the details on what they're planning exactly to do. What I can tell you is that, and in general, Alberta Health Services executive officers have the power to create orders that require people who are not following the current Chief Medical Officer of Health orders to comply with those and to close businesses or organizations or establishments who have not met the expectations after education, offering support, and the orders to comply have not been successful. In addition, law enforcement officials are able to issue fines to people who are not complying, but the judgment and how they apply those particular penalties is up to those local groups as they're doing their jobs on a local level to work with organizations and communities to remind them of why it's so important to follow the orders and to protect their communities from the spread of COVID-19.
Operator, could you put through the next question, please?
Matt Woodman, CTV Edmonton.
Hi, Dr. Hinshaw. To what extent has a COVID-0 plan been considered in Alberta, and why has it not been chosen? Why isn't it the right move for the province?
A COVID-0 plan has been used by some jurisdictions, and depending on when it was implemented, comes with greater and lesser degrees of impact and harms of those restrictions. With respect to Alberta's current position, we do have vaccines starting to roll out. We have a interdependency on other provinces and on other countries, such as the United States. And so the harms of an approach to drive to zero at this point in time versus the ability of our current framework of measures to minimize transmission while still allowing activities to take place is something that needs to be taken into consideration. And we have always tried in Alberta through our policies to balance those harms, the harms of COVID against the harms of restrictions, and that continues to be the approach to try to seek that balance.
Operator, could you put through the next caller, please?
Lauren Krugel, Canadian Press.
Hello. We heard on Friday that the province will be focusing on hospitalizations as the metric to use in deciding whether it's appropriate to ease restrictions. But since that's the lagging indicator, I'm just wondering whether you'll be looking at that same metric in deciding whether to recommend reimposing restrictions, or whether you'd be looking at a measure that gives more of a current snapshot of the way the virus is spreading.
The framework announced on Friday has two components. So the moving forward metric of looking at whether or not we can ease our restrictions, as you say, looks at overall hospitalizations, which combines both ICU and non-ICU. And so we do need to be able to meet the target metric in order to move to the next step. But there is also the important piece built in that we continue to look at our new case numbers, our positivity rates, and our growth rate, or our RT metric, to see whether or not our leading indicators, those three that I just mentioned, are increasing in a concerning way. And so those sort of act almost as an emergency brake. So if we meet those hospitalization numbers, but all of our leading indicators are escalating in a concerning way, then we would pause our move forward, and we may indeed need to move backward. So the leading indicators will tell us when we may need to take steps back, and those lagging indicators are the required metrics to reach before we can take that step forward into easing measures.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Dean Bennett, CP.
Hi, Dr. Hinshaw. Just following up on Rafi's question. I'm not clear. It seems like there's a pattern emerging here. Restaurants don't want to follow the rules, and therefore you open up the restaurant rules. Grace Life Church decides it's not going to follow the rules, even though you've already sent a closure order to it, and you still allow 300 people plus week after week. You're not sending the message here that the Alberta government, at the end of the day, they'll scold you, they'll remind you, they'll have Mounties take license plates, but at the end of the day, no organization is going to get shut down by this province for violating health rules. Isn't that the message being sent here?
I want to be clear that no matter whether it's law enforcement or Alberta Health Services executive officers, it's critical that the enforcement of laws in the province is done in an independent way by those bodies who have the authority under legal frameworks to create orders or penalties. And so it would not be appropriate for me to dictate what kinds of penalties would need to be in place in an individual case. I have spoken with chiefs of police and Alberta Health Services to be clear that a gradually escalating process is what we have set out the orders to be able to do, which is that if the education and support fail, then the framework absolutely includes penalties escalating to fines, but it's not appropriate for me to direct in an individual case what exactly should happen. That is at the discretion of local law enforcement and local Alberta Health Services officials who have the legal authority to make those decisions independently. And those who are putting their communities at risk need to be reminded that this is not optional, this is mandatory.
Operator, could you put through our second last question, please?
Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Thanks for taking the time to take my question. Just a couple of follow-ups on the new variants. Can you, with how rapidly the new variants spread, can you take me through your level of concern finding 14 new cases since we had that report on Friday, now up to 51? And with the new cases that are not linked to travel, at what point do we say that this is community spread or possibly community spread? I know you had mentioned the containment within the households. And can you give a clear number of that 51? How many are of non-related travel? And do we have a benchmark at all of where we need to get to with the spread in order to potentially look at different measures? I know we had mentioned that it was something you were keeping an eye on when those steps were announced on Friday.
Thank you. So with respect to the variant, we currently, as I mentioned, have 51 cases. Of those, there are 6 cases in 3 different unrelated households where we don't at this time have a clear link to travel. And of course that is concerning, as it seems that in those cases there may have been a source that we haven't identified, indicating that there likely is some spread in the community that we have not yet tracked back. All the rest have a link to travel, either that individual traveled or is a household contact of someone who traveled. And part of the reason for the increase over the weekend is that there was a batch of travel-related positive tests from over the last month that hadn't yet been sequenced. And so that sequencing was completed over the weekend. And so to be clear, it's not that there were 14 new cases that were just diagnosed. Some of these are historical. And so now we're going back to make sure that we're following up and ensuring that, again, with each of those cases, there was no onward spread. But it is not an escalating number from the perspective of local transmission. At this point in time, what we need to do is follow all of the COVID measures in place as closely as we all can. And in addition to that, we are looking at whether or not there may need to be some additional precautions taken when we do have a variant of concern or a close contact of that individual. And there will be more information coming on that soon.
Operator, could you put through our final question, please?
Thank you. The final question is from Lisa McGregor, Global Edmonton.
Hi, Dr. Hinshaw. I was wondering if it's possible that Alberta will ease restrictions sooner at any stage if we keep moving at the current rate with hospitalizations continuing to decline. Is there a point where if a benchmark is reached sooner that the province would consider shifting or putting stages up sooner to reopen and ease restrictions? And what would be that benchmark and when would that be made?
One of the important pieces of the framework that was announced on Friday is that 3-week time period between easing measures and considering a next step. The reason that 3 weeks is so important is that when we do ease measures, we have to watch to see whether or not the activities that we've opened up are contributing to additional spread in the community. And again, looking at those leading indicators of positivity rates, new cases, and growth rate. And so the current framework does require that 3-week time period because, again, what's important to remember is that while that hospitalization number is continuing to drop, if our case numbers start to rise again, we will see hospitalizations start to go up with a bit of a lag. And so even if our hospitalizations have fallen below a future step metric, if our cases start to rise because we've opened activities, then we shouldn't just count on that lagging indicator. We also need to look at that leading indicator. Those two things have to come together. So at this point in time, that framework was set out so that we would be able to cautiously open, particularly as we see some early concerning indications that we may have some spread of variant cases in the community. We do need to maintain caution and proceed slowly.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.